That's a great question. And that's why we think that these studies are so important because, whenever you do a research project, you ask yourself, why does this matter? Why do we care? And I would say the reason that we care is because our population is aging. We're seeing more and more urologists needed in the community. Now, this study is talking about pediatric urologists, but nonetheless, just in urology in general, we are expected to have a workforce shortage in the coming years. And so we really need to work on retaining urologists, convincing people to come into urology and train and become urologists. And if we keep seeing these high rates of burnouts and people leaving, then we're in danger of not being able to fill those spots and not being able to take care of our patients as urologists. I think the other thing that's really important to emphasize is that there has been really great research done prior that has shown that higher rates of burnout are correlated with higher medical errors, depression, suicide, and even health effects like cardiovascular disease, diabetes. So I think it's important for both patients and for providers. For patients, it's important because more burnout is probably going to lead to more medical errors. And then also more burnout is going to have health effects on the providers. And if the providers are depressed, suicidal, have diabetes, coronary artery disease, and can't practice medicine, then that eventually will affect the patients as well. So that wasn't research that came out of ours, but I think this is just adding to the data that says, hey, we need to be cautious of this because we're going to face the consequences long term. So we did ask in our survey about coping strategy, and we did look at those that kind of had the high burnout scores versus the moderate or low burnout scores. We didn't do a statistical comparison, but we just looked at what their survey responses were. The three most common themes among both groups, number one was family time, number two was working out, and number three was sleep. And so I think we can probably all relate to all three of those. So spending time with your family, that's obviously going to, for most people, bring a lot of joy, and having a breath outside of work. Working out, I mean, again, this is not based on my research, but I think everyone probably agrees that they feel better after a workout, and workouts have been shown to improve health, endorphins, energy. So I think that one's pretty obvious. And then sleep, this correlates with, the finding in our study that showed those who worked more hours were more likely to be seen in the high burnout group. So just being able to get adequate sleep has a huge effect on stress and how present and energetic you can be during the day. So I think those were the common themes that we saw, that those were probably the three most common coping mechanisms. Our study did not evaluate whether these coping mechanisms were successful. So that wasn't the design of our study. And there has been other research, but it's so difficult to perform this kind of research because it's nearly impossible to isolate one intervention to try to do some type of randomized control trial where you're saying, these people get family time, these people get gym, and these people get sleep. You can't really, it's difficult to do. So we need to come up with an interesting study to kind of better evaluate which coping strategies are best for mitigating burnout. But I think that's probably going to be a challenging study to design.